Halloween week is here. Many of you have candy on your minds, maybe in your mouths, so it's important to remember moderation is key. This morning, St. Luke's dietitian and clinical nutritional specialist, Mary Cherne, is connecting live with us. Mary, good morning.
Good morning. Thanks for having me.
Yes, so Halloween week is here. We're ready to eat that candy, but moderation, as I mentioned, is key, right?
Absolutely. So although trick-or-treating might look a little bit different this year, it doesn't mean that candy isn't around. And so there's some things we can do to help make sure that we're still eating candy in moderation. It's perfectly okay to eat candy, but we want to be kind of smart about how we do that too. And so one thing that we can do is keep busy. If we're staying busy, we're keeping our hands occupied, keeping our mind occupied, it's going to limit that boredom eating or the number of times that we reach for the candy dish. And so it's a great year to start some new traditions.
Right, exactly. And many of us are staying at home more. It's easy to sit on the couch in the evening and reach for another cookie or a candy bar. What are some tips that you would have for us to maybe not do that as much?
I would encourage you to celebrate the holiday in different ways this year. So maybe make a Halloween themed meal. Maybe you have a scavenger hunt around the house. Playing Halloween music, having virtual costume contests. By having things to do, things to keep us busy, we're less likely to be kind of mindlessly snacking or continuing to reach for that candy dish.
I haven't been snacking at all during this pandemic. Have you?
No, not at all. A lot of us have been maybe doing a little boredom eating, a little more stress eating than usual. And we all do it. It's to be understood. It's pretty common.
Right.
But finding other ways to manage those things, other ways to manage stress, maybe going out for a walk, going out and raking the leaves, clearing the snow this year.
And I'm seeing some treat bags behind you this morning. What are some maybe alternative options we could give out as healthier options for Halloween?
First off, we want to avoid communal dishes, kind of communal candy bowls, communal snack dishes this year to limit the spread of COVID-19. And so if you want to individually package treats, that might be a way to limit kind of the number of people who are touching the same things. But think non-food or non-candy treats too, especially when we think about the number of kids these days who have food allergies. Things like bubbles or erasers or little notepads. There's tons of different options, little spider rings, things that are going to be good options for all kids. They're all going to be able to enjoy them and maybe add some more fun to the holiday beyond just the candy.
There you go. Perfect. Maybe hand out some broccoli. Then you'll never have trick-or-treaters again, right?
There you go. You might turn some of those kids away this year.
Right. Is there anything else that you would like to share with us regarding nutrition, maybe the holidays? I mean, we're all going to be eating a lot with Thanksgiving and Christmas.
Even though we're not necessarily going to be seeing family and friends in person as much this year, make sure that you're staying in touch with people. And like I said, limiting those kind of common dishes, maybe not passing food around family style or buffet style this year. If you are getting together with people. Otherwise, those things that we all know, wear your mask, maintain distance, washing hands, super, super important this year.
Definitely, especially if we're preparing foods, right?
Yes, absolutely. Absolutely. Remember your regular food safety, but on top of that, make sure you're washing your hands a little extra this year.
All right, Mary, is there anything else that you'd like to mention?
If you find that you're really struggling with the stress eating or boredom eating or kind of all the changes that we're experiencing this holiday season, make sure you reach out to your healthcare provider, reach out to family, friends, get that support, and try to maintain some routines. Even though it feels like everything is changing, we can still have regular meals, we can nourish our bodies, and we can move our bodies in ways that are enjoyable. Going for walks, getting outside, turning some music on and dancing.
Definitely.
Just make sure that you're maintaining those routines and maintaining some health this holiday season.
Exactly. And I do want to reiterate, it's safe to come and see you folks at the hospital right now, right?
Yes, absolutely. We are open, we are here, and we want to see you. So your clinics are open, hospital's open, our brand new emergency room is open. And so if you need anything, don't hesitate to reach out.
Perfect. Mary, thank you so much, and happy Halloween to you early.
Thank you. You too.
Yes, and remember, Northland, if there's anyone that you would like to hear from in your weekly coffee conversation, just be sure to let us know.